Hi, everyone. Thank you and welcome for joining us today for this workforce discussion on our newest positions at the Tompkins County Health Department, Community Health Workers and a Community Health Worker Supervisor for a new program called the PICHC program, which is for perinatal and infant community health collaborative. Nailed it. We are going to describe what that program is all about. We're joined today by Claire Espey, who is our Director of Community Health Services. And I'll let Claire introduce herself in just a moment. But before I do, I'll introduce myself as well. My name is Shannon Alvord. I work at Tompkins County Health Department in Health Promotions. And I'm really excited to be sharing about this new program that we're getting ready to launch. Some quick information about applying for jobs at Tompkins County in general. I'm going to share my screen. Hopefully this will work out for everyone. Okay. So can you see my screen, Claire? Okay, beautiful. Thank you. So when you sign on to tompkinscivilservice.org/civilservice/vacancies, you will be brought to the current vacancy list. And as you scroll down, you will find both the community health worker position as well as the community health worker supervisor position. With both of these positions, they are civil service. You apply online. So you click the apply button. It will bring you right to the positions page. We'll ask you some basic questions about your minimum qualifications, and then it will ask you to log in or register. So you will go to, you'll be directed to this page from there. If you already have an account, you can sign in with the login, or if not, just use an email address that you use frequently. It's especially important to make sure it's an email address that you use frequently because once you have registered in the system with the Tompkins County Civilservice.org, you'll get announcements about opportunities that are coming up. If you do apply for a job and there's a civil service test coming up, you'll get a notification about that through there. So it's really important to make sure it's an email address that you access frequently. And that is how you get started with that process. If you do have any questions about any of the human resources section, please contact our very helpful folks at the Human Resources Department at Tompkins County. They'll be happy to help you troubleshoot the application process if you have any questions. But otherwise, the job descriptions will really show you what information you need to upload, if there's specific questions or requirements regarding the position that you're interested in, whether you're asked to provide a cover letter or a resume or not. That information will all be a part of that application process. So that's a little brief human resources introduction there, and hopefully I've done an okay job of describing that. But please do reach out to Tompkins County Human Resources if you have any questions. Now, I'm so pleased to introduce you to Claire, the Director of Community Health Services here at the Health Department. Claire, would you mind introducing yourself quickly?
Thanks, Shannon. Hello, everyone. I'm Claire Espey. I joined the Tompkins County Health Department in December of 2020. As the Community Health Services Division Director, where I oversee the team and our communicable disease and maternal child health programming in the department. My background's in public health, and outside of Tompkins County, I have experience in international maternal and child health programs and community engagement. Our community health services programming spans both communicable disease surveillance and case management, immunizations, and maternal child health programming as well. Thank you.
Thanks, Claire. I'm curious if you could share with us just a little bit more about some of the programs currently being offered at Community Health Services.
Yes. So as I mentioned, we have sort of two components of our work at the Community Health Services Division. One is really focused around communicable disease surveillance and case management, and the other is around maternal child health programming. So that includes the WIC program and Moms Plus program, which is a nurse, community health nurse program with home visiting nurses.
Thank you. It's really great time for you all to join us to learn more about these programs, since we're really working hard at reopening a lot of the services that have had to go on pause for a while during the pandemic. So thank you so much for that. Now I'd love for you to share a little bit more about PICHC in particular. What is PICHC all about? What can people look forward to seeing coming from the health department soon?
Yes, so the PICHC program, as Shannon mentioned, is an acronym. It's a Perinatal and Infant Community Health Collaborative. It's a state-funded grant program that begins on July 1st, 2020. It spans 5 years with the possibility for continued funding. The goal of PICHC is to improve perinatal and infant health outcomes, and particularly to eliminate racial, ethnic, and economic disparities in those outcomes, while incorporating a holistic approach to achieving racial and reproductive justice that promotes supportive services, particularly for high-risk individuals and families, through collaboration via shared services network. So this is a new program for Tompkins County Health Department, but it is and has been implemented in approximately 30 other counties in the region. So we will be implementing this program at Community Health Services Division in collaboration. It's a joint program between the Health Promotion Division and Community Health Services Division.
Excellent. Thank you so much, Claire. Okay, so now let's talk about these job openings that are coming along with the new PICHC program and the positions that will really support launch and help to implement this programming.
Oops. So I'll talk about the vacancies, yeah. So as Shannon mentioned, we have one community health worker supervisor, and that position is focused on prenatal, postpartum, and infant health. So the PICHC program. This is a full-time position. It's 35 hours a week. And the hiring rate to begin is $30.20 an hour. The current application deadline that we've set is July 4th. And if we need to extend that, we may well do so. So that's our aspirational goal. The second category of the job description that we've posted, we're hiring for 2 community health workers, and those will also be primarily focused on prenatal, postpartum, and infant health on the PICHC project. These are also full-time positions, 35 hours a week, and the starting hiring rate for these positions are $23.95 an hour. The application deadline that we have currently is June 27th, so about 5 days from now, and we will extend that if we need to. So those are the 2 positions that we're hiring for at the time.
Excellent. And what would you say are the main function purposes of this role? What kind of duties would folks in these positions be expected to do?
Yeah, so the first position, the Community Health Worker Supervisor position, this person will oversee 4 community health workers at the health department, and they'll assist the PICHC program team and other health department teams with community capacity building, civic engagement, promotion of individual and collective decision-making through education, skill development. There'll be a lot of networking, event organizing, and building partnerships. So this is a project management role and an oversight supervisory role. The community health workers, they'll be focused, as our other community health workers in the health department, focused to support marginalized populations to promote and ensure equitable access to public health resources and services. So they'll be conducting outreach activities within the communities. They'll work directly with individuals and families, coming to do home visits or meeting them wherever they choose to do assessments and help plan for health supportive services and connect them to other services and community resources.
Excellent. Thank you, Claire. How would you say that these positions fit into the overall vision and mission of the Tompkins County Health Department?
As a reminder, the Tompkins County Health Department mission is to build a healthy, equitable community in Tompkins County by addressing the root causes of health disparities and integrating mental, physical, and environmental health. Community health workers are an essential part of the public health infrastructure to help serve the community, to access care and support services that will improve health and address social determinants of health. And also we see them as helping to facilitate two-way communication between healthcare providers and programming staff and the public for an improved quality of services and accountability. The vision of Tompkins County Health Department is really aiming for every person in Tompkins County can achieve wellness. And so that really includes those experiencing barriers to access and those currently experiencing worse health outcomes. Through the PICHC program, we're prioritizing the most vulnerable, the most at risk for adverse health outcomes, and we're really focusing on trying to reduce disparities in related health outcomes, particularly along racial, ethnic, and economic lines.
That's a really excellent overview, Claire. My next question for you is, how does this position support the Tompkins County community? And you've spoken a lot to really the overall goal of not just the work of the community health workers, but of Tompkins County Health Department as a whole, is to look closer at these inequities and barriers and work to problem solve and address those. Is there anything else you'd like to add to that about how these positions are going to support the community?
I think you said it well. I might just add an emphasis on the fact that these positions are really helping us to form a bridge between the community and the service providers, which include our health department. And we're really aiming to increase our understanding of what the needs are and how to best serve those needs and increase trust with the public in our systems. So through the community health worker model, increased collaboration between community service providers and other stakeholders, we're really aiming to increase the efficiency and effectiveness of our available services, and we're trying to use our resources in the most responsible and accountable way.
Great, thank you so much. Are there any specific skills needed, degrees, backgrounds, experiences? What are you looking for when hiring for these two positions?
Okay, so I'll start with the supervisor position. So the minimum requirement is graduation from high school or possession of a high school equivalency diploma and 5 years minimum experience working in a community health worker role or the equivalent. Another way to satisfy the minimum criteria for that position include graduation from a regionally accredited or New York State registered four-year college with a bachelor's degree in something like public health or social work or mental health counseling, human services, or a similar related field, and with 3 years of experience. And then the third way to qualify for the supervisor position is with a graduation from regionally accredited or New York State registered college or university with a master's degree in public health, social work, mental health counseling, human services or related fields, and 1 year of relevant experience. So we have a number of different combinations of experience and education that we are trying to find the best candidate for the supervisor position. For the community health worker position, the minimum requirement is graduation from a high school or possession of a high school equivalency diploma and 4 years of experience working with clients in human services or any related field. We'll also be looking for any candidates that have graduation from regionally accredited or New York State registered 2-year college with an associate's degree and 2 years experience working with clients in human services or related field. And we'll also be considering candidates that have graduation from a 4-year college or university with a bachelor's degree.
Excellent, thank you. And while I was listening to Claire kind of talk through those specific requirements in terms of background or experience, it reminded me that sometimes when you apply for civil service jobs, just because of the structure of the system that you input your application into, depending on your own background and how it kind of connects to this job position, you may receive a letter to your email address that you use when you apply that says that you don't have sufficient experience or something to that effect. Please do take advantage of the opportunity to write a letter back to HR describing why you believe you are a candidate for this position if this happens to you, particularly with this community health worker role where we're really looking for folks with, as Claire mentioned, background and experience in that can be really, really helpful information that would support your application, where as your kind of resume maybe isn't directly in alignment with how the system has kind of input it. So please do take advantage of that appeal process. Thank you, Ellen, for putting that word in the chat box, because it absolutely is worth doing. And so don't get offended. It happens to a lot of people. It happened to me. So please go ahead and use that process to your advantage. And kind of going along with that, Claire, are there any other qualities or skills that would really make for a successful candidate in this type of position?
Thanks, Shannon. So the training will be provided for the PICHC program. It's part of a larger training program, and it's a significant component to ensure that our community health workers and supervisor are adequately trained and resourced. Applicants should possess excellent listening skills and other interpersonal communication skills. That's a must for this program. A passion for public health equity and strong ability to build trusting relationships with community members and local community initiatives and coalitions. Ideal candidates will have experience with supervision and program management for that supervisor position. We do want someone who can lead the team and has that experience of supervision. For the community health workers, as I mentioned, training will be provided. And what we are really looking for in our applicants, we're hoping to represent the diversity of cultures, backgrounds, generations, social identities, lived experiences, and neighborhoods in Tompkins County. And we're expecting that they will be able to work to further develop relationships in a culturally sensitive manner to advocate for and support individuals and families in their access and understanding of public health services. So I would also just maybe mention something as you were talking about the process, and not to miss any opportunities. We encourage people to submit their resume and cover letter in addition to the application fields that are required by the software. It just helps us to complete the picture. So that would be helpful to note.
Yes, absolutely. Thanks, Claire. And one final question that I have for you, and then we'll take any questions that our participants may have today. What what is it like to work for the Tompkins County Health Department and Tompkins County's Community Health Services Division?
Great question. I could ask you the same. The Community Health Services Division is like a family, very supportive team, and we help each other to problem solve and to get things done. We're very adaptive. COVID has demonstrated our adaptability and our resilience, and we do have fun and we work hard. We have 6 community health nurses, 2 community health nurse supervisors, 2 administrative and billing staff, and we also work with 4 WIC staff and the WIC director, as well as 2 public health fellows. So that's the family that I'm referring to. And we also have great collaboration with other divisions, such as the Health Promotion Division and others at the Health and Mental Health departments, and including 2 of the community health workers in the Health Promotion Division. We have great leadership. They try to listen to our ideas and support us where we need it. And they have demonstrated they are willing to take risks, to try new things and implement changes and innovations to increase our impact. So it's a great place to work.
Yes, agreed. I would echo your sentiments that the health department is like a family, and that there's great leadership, encouragement of innovation, all of that. Definitely agree with you on that. Well, thank you so much, Claire. Those are all of the questions I had for you today. Do any of our participants have a question? Feel free to pop it in the chat, or you can submit it directly to me anonymously if you'd prefer. Give just 1 minute if there's any questions. Okay, well, if there's no questions, I think, oh, thanks, Ellen, we have a question. Oh, we got 2 questions. Okay. Oh, we got a few questions. All right, never mind. We won't close up early. Thanks, guys. All right. So the first question that came in is, one of the largest issues right now is the need for more prenatal care options. Will this role support that?
Great question, and getting to the heart of the goals of the PICHC program. Our goal is to connect prenatal, interconception, and postpartum parents with the support services that they need, including prenatal care. I think there is potential to collaborate with the other service providers and stakeholders to address any gaps. And we did, as part of our proposal process, assess the needs and the gaps. So we'll be building off of that. And I think using the community health services, community health workers as well, to help overcome barriers to services that are available is going to be the initial focus. And as we come together to develop more creative and bigger solutions to these challenges, I would say, you know, more care will be a goal for the program. Yes.
Great. We have a question asking, are we required to take a civil service exam?
Yes. The civil service exam is scheduled by it's above the county. It's at the state level, I believe. And so we will be hiring for this position and then work with them to schedule the test for that position. So we don't have a date yet, but the position, like mine, was filled, and the work began, and then the civil service exam is organized and made available after that.
Mm-hmm. Yeah, and it can vary the length of time that you may wait between hire date and the date of your exam. Okay. The next question is, how closely does the PICHC program, I guess we could say, will the PICHC program, or maybe your current program's Moms Plus program, how closely will the program work with the hospital?
Very closely. So we have an existing relationship between the Moms Plus program and the Cayuga Birth Center, which is the birth unit for the hospital, the maternal child health unit. So we do several visits each week to work with them and to meet prospective parents, and they also attend regularly our quality improvement meetings, so they can advise on how to improve services. I think we have gone further with the PICHC program, working with the community outreach specialist, Lara Perilla, has been really critical to developing our relationship with the hospital. And we've recently incorporated their social determinants of health screener. So trying to kind of figure out ways in which our systems can really more fluidly interact and ensure that we're able to follow up on these really important referrals to support service resources. But yeah, the hospital is a really critical stakeholder that we work with. So great question.
And one last question I'm seeing here is, what kind of training will be provided?
I don't have the exact details, but the State Department of Health, through which the grant, through which we're funded for this PICHC program, they have contracted out for a specific service provider to run all of the trainings. And the first initial training will be from the 18th to the 20th of July, and then I think additional training in September or October. So there'll be some core modules for community health work principles and approaches, as well as specific content and topic related trainings. And this is something we've been working on already with our existing community health workers and the other partners in Tompkins County, is how we can really cross-train and shadow and get a sense to build relationships and learn the skills of community health work through really hands-on shadowing and experience. So we're also working on cultural humility training that we'll be organizing in July, August. That's an important one. And we've also solicited training needs and organized trainings based on the needs that emerge from the team, and discussions with stakeholders as well.
Great. Thank you so much, Claire. And thank you to our participants today for your excellent questions. Those were really, really helpful in moving our conversation forward. Thank you all so much. And with that, I'm going to close out our webinar for today. So thank you for joining, and thank you, Claire, for sharing so much about these new positions. Look forward to getting a diverse pool of applicants for our new community health workers and a community health worker supervisor. Thank you.
Yes, thank you very much.